Good morning. Lifting is a tough act to follow, but I will try not to put you to sleep. I'm really excited to be talking to you today about the future education model and the competency-based education. Let me see a show of hands on how many people are familiar with the future education model. A few people. Good. I'm going to rely on you to answer questions as we go along, so stay awake. Nothing like submitting your stuff to the Iowa Academy and finding out you have typographical errors when everything is in print. So I do want to highlight a couple of things that got left out from your learning objectives as I go along, so please bear with me. In your session description, I'm going to talk about the changes that are coming to dietetics education, and we're going to talk about competency-based education as well as assessment, and more specifically pertaining to the graduate training of registered dietitian nutritionists going forward in this new model. So one of the first changes coming up is in your learning objectives. So the learning objectives for this session really are to familiarize you about the future education model and recognize the distinction between, and this is where the things got left out, two very significant things. I had competency units and enhanced competencies, but I forgot to include competencies and performance indicators in the learning objectives. So I will be talking about those as we go forward as well. And then become familiar with what is competency-based education and how this impacts students training who want to become registered dietitians. Before we talk about future education model, let me set the stage for you in terms of what changes are coming up. Some of you may be familiar with these. The very first change that we're looking at is coming up through the Commission on Dietetic Registration, which affects students who are going to take the registration exam for the very first time. Starting January 1, 2024, graduates of DI programs or coordinator programs will need to also have a master's degree if they want to take the RD exam starting January 1, 2024. The expectation is that the master's could be in any subject, well, most any subject. It does not necessarily have to be in nutrition or dietetics for that matter. So starting January 2024, any student who wants to take the RD exam will need to have a master's degree as well. Now the big change that's coming to dietetics education is by our accrediting body, which is Ascend, and they are proposing the future education model, which I'm going to talk about here in a second. And the reason I have 2030 as with a question mark there, anybody want to take a guess? We're just getting started with implementing the future education model programs. We have had 2 cohorts of programs that have started. Some are even enrolling students. And I have 2030 here with a question mark because it's going to take us at least 10 years, if not longer, for Ascend to collect data from programs that have changed to a demonstration program, collect data and evaluate the success of student outcomes and program outcomes to evaluate whether and how we proceed forward with the future education model. So this is not something that is going to be implemented tomorrow by every single dietetics education program. There are several programs that are trying to be early adapters. Iowa State is one of them, and I will talk about that in a second. University of Iowa has already transitioned to a future education model. When Ascend proposed their future education model changes a few years ago, they had proposed a 5-tier model, and only the 3 middle tiers, the associate's, bachelor's, and master's degree have made to the level where we have competencies and performance indicators, and we are enrolling programs into these degree levels. The high school level and the doctoral level are still being talked about and are being envisioned for maybe perhaps a future discussion. I'm going to talk a little bit about the associate's, bachelor's, and master's degrees level here, what the program requirements are, and how these are different from how we currently educate students at each of these levels. The expectation under the future education model is that each degree level would synergistically incorporate didactic as well as supervised practice or supervised learning, experiential learning together in one degree program. And the expectation also is that each degree level will prepare graduates for employment. Other additional expectations of future education program requirements are that the programs must award a degree as well issue a verification statement on completing the program requirement. One of the biggest changes that is coming to the future education model is that there are no hour stipulations for students to complete. Right now, we require students to complete 1,200 hours in supervised experiential learning, or supervised practice rather. Going forward, there is no such stipulation from Ascent. Programs, however, are free to stipulate how many hours they would require each of their students to complete supervised experiential learning going forward. Part of the requirement also is so programs can meet state licensure laws to satisfy that requirement on how many hours graduates have spent in supervised learning. New competencies and performance indicators have been identified for each of these 3 degree levels, and I will talk about those shortly. So let's look at what each of these degree levels are and what their scope of practice is and what the setting for practice for each of these degree levels is. The very first one is the Nutrition Health Associate. This is at an associate's level, and the work expectations are in, I don't even know if my pointer will go, but in this green bar that you can see, the practice expectations or environments are listed there for this new degree level. They are expected to, there's this, sorry, can't talk this morning. Good thing I'm not presenting today. So the Nutrition Health Associate level is something similar to a community worker position that we currently have. But going forward, Ascend is expecting that this degree level would also have some supervised practice requirements built into their program and will be available to help practitioners with data collection, farmers market, doing cooking demonstrations, and so on. And be able to work in home health agencies and community service agencies and so on to do simple tasks, be a peer support to workers in these organizations. The Nutrition and Dietetics Technician is going to be transitioned to a bachelor's level training program. Again, the expectation is students who want to train to be registered nutrition and dietetic technicians will be graduating from undergraduate degree programs, would also have supervised experiential learning requirements along with didactic learning in their programs, and will be working under the supervision of a registered dietitian. Their scope of practice and settings for practice would be healthcare institutions. They can work in grocery stores, health clubs, schools and colleges and universities, and can assist the registered dietitian in the care of non-complex patients. I don't think this needs any introduction in this room. The registered dietitian nutritionist, again, there are some changes to the work settings and the future practice model for the registered dietitian. But again, the biggest change is from an undergraduate training level. The future education model is expecting that future registered dietitian nutritionists will be trained at a graduate level, and again, their program will include supervised practice as well as didactic learning in one program combined synergistically. Again, healthcare institutions, research institutions, or research is a new area of practice that is being emphasized a lot in the future education model for dietitians, as well as community organizations and management of programs is something else that is being stressed in the future. Leading interprofessional teams is something the Ascent requirements are focusing on to train dietitians to lead community organizations, lead management programs in different institutions, whether it's at the university level, whether it's at a hospital or a public health program. Okay, so let's shift gears just a little bit and talk about competency-based education. What comes to mind when you think about competency-based education? Is the concept of competency-based education new to the practice of dietetics? Yes, no, maybe, not sure. This is not something that's new for us. We have been training dietitians. We have competencies even now that we train future registered dietitians in. But the concept of competency-based education is just a little bit different, and let me expand on how and where the differences are. So competency-based education really follows the model of outcomes-based approach to design, implement, assess, and evaluate not just programs, but students who are part of a competency-based education model. We have a framework of competencies, and the beauty of a competency-based education is it can be customized to any type of program. So it's not one size fits all, essentially. You can customize it to meet the needs of your program and your student population. The requirement, however, is that it must utilize a competency framework and have competency-based assessments included. And you have to follow the model that's outlined at the bottom of identifying competencies, then identifying learning outcomes, and finding ways on how you're going to assess learner acquisition of these learning outcomes, and then teaching initiative to meet these learning outcomes and objectives. Might be a little hard to read, but the few things that I do want to highlight, the differences between traditional education and competency-based education. Traditional education is really time-based and it's more instructor-driven. However, competency-based education is not time-based. It's based on the learner's ability to master the competencies and performance indicators that they are required to achieve. So it's really a student-driven model of education where the central focus is on the student's ability to learn and master concepts. What is also important here is how we assess where students are, how they need to learn, and where they are in the learning continuum, what things they already know, and what things they do need to master additionally to meet those competencies. So competency-based assessment is really not a checklist. We've gotten so used to having a task list that we check off, I've done this, and I need to do X, Y, and Z to meet all the requirements of this rotation. Things don't work that way in competency-based education and with competency-based assessment. The focus really is on the application of knowledge, skills, and judgment of the students on the assigned tasks and competency that they have to master, essentially. Students should be able to distinguish between the skills that they need and the skills that they currently have, and then work synergistically with the preceptors, with their instructors, to come up with a plan on how to master those skills and competencies. Competency-based assessments really need to be conducted frequently. You cannot do one assessment at the middle and one at the end and call it job well done. It doesn't work that way. You have to evaluate the students' progress throughout their rotation, provide formative feedback to the students, and make any changes to their plan going forward to ensure their success and to meet the needs of those students. I'm not saying that's not happening, but it's not happening consistently all around during supervised practice. Okay. Whoa. Hello. So what you're missing here is not a food guide pyramid, but a pyramid, which has 3 tiers on it. And you can essentially see the colors, maybe not. So the bottom tier is of the pyramid, has the word nose on it, nose, which refers to fact gathering and acquiring information for the students. This is the Miller's pyramid of competency assessment that you will be hearing more about with competency-based education. The knows, does, and shows model is what Ascent has adapted to identify and to track a student's progress through competency-based education. Excuse me. Knows would be happening in didactic classwork where students are learning new concepts and are demonstrating their ability to learn and master those. The second tier is shows, where you're demonstrating the mastery of those didactic concepts. So this can be occurring through case studies that students are taking or participating in to demonstrate that they have mastered the concepts that they learned in class. And then performance in practice essentially is where the does part happen, where the students are hitting supervised practice sites where they're actually demonstrating that they have the ability and the skills to take care of patients in a clinical environment or in food service operations or community nutrition facilities. Right now, as part of the dietetic internship, when I send students to supervised practice sites, they're essentially doing the top tier of this pyramid, the doing part, and we are not so much seeing the knows and the shows part of it. Going forward, all three of these would have, our expectation is that we will be tracking students' progress through all three tiers and assessing their progress in mastering these competencies. Okay. So summative and formative assessments are really big parts of this future education model and this competency-based, competency-driven education model. Formative assessments determine essentially what the students already know and what else they need to know, and supports a generalized plan and approach for teaching dietetic students in the future. And this is not just for training dietitians, this is going to be at any level, whether at the associate's or bachelor's degree level. And you can do formative assessments through either self-assessment tools, reflective practice, where the students can participate in to identify where they are in the learning spectrum and where they need to go. So it's not just on the preceptors or the instructors, the learners are fully engaged and involved in identifying their learning needs and how and where they need to move. Summative assessments, typically we do a final assessment and call it even. Summative assessments are really going to be looking at an array of or a summary of assessments that have been happening and what the student is learning over a period of time. And you can do objective clinical exams, you can do simulations, you can do problem-based learning, and all of these are examples on how you can assess where the student is and how far they have come in mastering the competencies and performance indicators that have been assigned to them in that particular rotation or class. You can see the pyramid here a little bit better. It's a little fractured here to kind of make a point. The knows is where you're teaching them in class, they're acquiring new concepts, and the examples on the right-hand side are essentially some assessment methodologies that you can use to assess where students are. So you can administer exams, multiple choice questions, essay exams, however, to assess what the learning is. So this is no different than other didactic courses. Where differences are occurring now is in the middle rung, where we're asking students a little bit more to demonstrate how they would apply the knowledge that they acquired. So we would have some simulations for these students, we would have standardized case studies for these students to practice demonstrating their knowledge and applying it a little bit before they can supervise practice. And then preceptor evaluations and chart reviews will be ways of assessing when they are truly at their supervised practice sites. Nothing different than what we're doing right now. I'm providing a very brief overview of competency-based education. For those of you who are interested in learning more, Ascent has created a couple of videos on competency-based education and then one specific for preceptors. And we have posted both of those on our website. And the website address is listed at the bottom of the slide. It's dietetics.iastate.edu. And they're at the bottom of the page, as you can see by those arrows. They're about 30-minute interactive videos. They have some assessment questions as you go along, so it kind of gives you an idea of what this competency-based education model is moving towards. One of the new concepts that I want to introduce you to with the future education model is what is called the functional analysis model that Ascend has adapted to identify the competency units, the competencies, the performance indicators, and the examples of those practice illustrations that students need to perform to master their competencies. Now we know competencies, that's no different, but this is just a different way, a 4-tier model on identifying what the students need to learn at each level of education, whether at the associate's level, bachelor's level, or master's degree level. So the units, or the level 1 is competency units as it's called, and that essentially describes a group of competencies that each degree level or each student needs to master. And under each competency unit, you would have competencies and their associated performance indicators that have been identified. And I'm going to focus the rest of my conversation on these 3 tiers. The examples or practice illustrations is something each program can provide the preceptors when the students come to you on what the relevant competencies are and some examples or ways in how you can help the student meet those competencies. So competence is essentially nothing new, we're used to that, but now the focus is changing more towards the knowledge, skills, judgment, and attitudes that the students need to acquire and demonstrate, and these are associated with each of the competency units going forward. And then performance indicators are essentially your measurement criteria on how and what the students need to do to demonstrate that they have mastered that particular competency. And I'll share examples here in just a second. The future education model competencies, and this is a new concept for us because we really don't have associate level programs right now that have been accredited by Ascend. But going forward, the associates level program that trains a nutrition health worker will have 5 competency units and has about 20 competencies that are associated with it that these students will need to master. The competency units for the bachelor's degree, which is going to train the dietetics, and the master's degree level, which trains registered dietitians, are identical. What is different are the competencies and the performance indicators that have been aligned. And there are about 37 competencies for the master's level and about 36 competencies for the undergraduate level or the bachelor's degree level. So right here you can see the competency units that associate's degree level have to meet, and they are on foundational knowledge of food and nutrition, professionalism, individual and community services, cultural competency, and then communication, collaboration, and advocacy. And like I said, all of these are really based on the scope of practice and the area of practice that Ascend has identified for each of these degree levels. To just give you a comparison, on the left-hand side of the screen where it says 2017 standards, these are the domains which are going to be called competency units going forward, are the ones where we have competencies, and currently we have 4 domains where competencies for training registered dietitians reside. And these are under scientific and evidence basis of practice, professional practice expectation, clinical and customer service, and practice management, and use of resources. So going forward, the future education model for both the bachelor's and master's degree, the competency units are going to be in these 7 tiers. These are foundational knowledge of food and nutrition information, patient and client services for folks who have patient contact, food systems management, community and population health. This has been an area that has been very concerning to a lot of dietitians as we are moving towards the future education model, that community health and public health is going to suffer greatly but the Academy is putting a highlight on this population and training for future dietitians. Leadership, business management, and organization, and then critical thinking and research, and then core professional behaviors. So let's look at the competency unit, competencies, and performance indicators for each of the degree levels, so it kind of all connects together for you. So this is foundational knowledge, and if you go back a couple of slides, each of these degree programs have the same first unit, which is referring to foundational knowledge of food and nutrition. What is different is the depth and the breadth of knowledge that is required in each of these competency units. So for the associate's degree, they're required to have basic knowledge of food and nutrition to ensure safe, competent, and effective services. And under the competencies on the left-hand side, you can see the first three competencies in this: demonstrate an understanding of the principles of food and nutrition, integrate knowledge of determinants of health, and then demonstrate knowledge of wellness strategies that contribute to long-term health. And then on the right-hand side are examples of performance indicators that students need to demonstrate in order to master each of these competencies that are listed. One of the things that just recently changed not too long ago, Ascent made a recommendation, which was adopted by the board at Ascent, that we have to make sure our students are mastering every single performance indicator. Not just one, not just two, every single assigned performance indicator for each of these competencies. That sounds like a daunting task, but, excuse me. But keep in mind, going forward, we are combining a DPD program as well as an internship program, if you will, into the same program. So at some point in time, they will be demonstrated during the training. It does not all have to be during supervised practice. That's the part that we need to focus on, is this is not all happening during supervised practice. This is going to be spread out throughout the training of each of these students during their program, which would be about 2 years in length or so. All right, the future bachelor's degree foundational knowledge, again, just to give you an idea, the foundational knowledge, again, changes a little bit because the depth and breadth of the knowledge that students in the bachelor's degree is a little bit higher than the associate's level, and their competencies are applying basic knowledge, and now we're moving into environmental factors, molecular and genetics, and so on, because that is outside the scope of practice of the associate's degree level. And as you can see, the competencies for the first, or performance indicators for the first competency are essentially identifying and considering environmental factors and molecular factors and so on to treat and manage chronic diseases for the bachelor's degree level. And as we move to the master's degree level, which I will share in a second, you will see it is not just knowing, it is actually using that information to care for the patient and care plan for their care plan, their nutrition care process, and so on. And as you can see, the performance indicators are increasing as well because the complexity of care and the depth and breadth of their knowledge that the dietitians are required to have is increasing. So now we're adding genetics in here as well, and we have to demonstrate. It's not good enough for us to just know or understand. We now have to demonstrate how we are going to utilize this knowledge in our practice settings, whatever that may be, whether it's food service, whether it's care of the clients and patients, or it's another setting altogether. So just to give you an example, I know this may be a little bit difficult to see, but this is just the first three competencies I shared with you in the previous slides. This is looking at the 3 degree levels at one stage, and the point I want you to focus on really is the action verbs that Ascent utilized to construct each of these competencies, because they really are trying to showcase the skills, the knowledge, and competencies that the students in each of these degree levels are required to have as they go forward. All right, so one additional new concept concept that we have not talked about previously that is new to the future education model is something called enhanced competencies. Let me see a show of hands if anybody has heard that phrase before. Okay, so enhanced competencies you're going to be hearing a lot about. Enhanced competencies are something that Ascend has identified for for 2 of the degree levels that will move the scope of practice forward in the future. So this is really about expanding our scope of practice in the bachelor's degree level and the master's degree level. So let's look at some of the enhanced competencies that have been identified. There are, again, no identified enhanced competencies for the associate's degree level, only for the bachelor's and master's degree level. And the enhanced competencies have been identified in the areas of practice that are identified in this area right here for the bachelor's degree level, right here, the wellness counseling, the nutrition communication, and so on. And same thing for registered dietitian in the future as well. So for wellness counseling, moving forward, the enhanced competency that the bachelor's degree level students will have to master are really applying knowledge of nutrition and health promotion and disease prevention for individuals and groups. Work collaboratively with others to assess, implement, and evaluate community and population-based programs. These are just a few things that currently are not in the scope of practice of undergraduate being trained to be registered nutrition and dietetic technicians. But going forward, these are something that will be in their scope of practice. And the thing to keep in mind also is, we cannot implement these enhanced competencies now without a conversation with our licensure board. And I don't want folks who are on the licensure board going nervous. We can't do this right now, and you'll see what I mean when I talk about the dietitians and what their scope of practice and enhanced competencies are in the future. Because these are things that we are not able to do now. There is a lot of overstepping on other disciplines and some of the things that we will be expected to do in the future. And we cannot do this in isolation. We have to have a communication with the other disciplines and with our licensure boards to talk about how to implement these scope of practice changes going forward. You will have a copy to the slide, so I'm not going to take a whole lot of time, but this slide is essentially talking about how the nutrition and dietetic technicians will fit in with working with less complex clients under the supervision of a registered dietitian. So they can be responsible for managing less complex patients, and this would be part of their scope of practice going forward. Some of these things dietitians may be doing right now, so this is something that we will need to have a conversation on how we work synergistically with nutrition and dietetics, and if they have the potential to help you in your practice settings where you work. So let's look at the enhanced competencies for registered dietitians in the future. The very first one, which is going to raise some eyebrows, is really about prescribing medical nutrition therapy. That is not a big surprise, but a couple of things underneath this are talking about prescribing utilizing pharmacology and prescribing and recommending nutrition-related pharmacotherapy, which is performance indicator 2.5, the last one under prescribing medical nutrition therapy, which is clearly stepping on the toes of pharmacists. And so this is not something that we can do in isolation right now. We will have to have a conversation on how we do this. A lot of renal dietitians are able to do this right now. A lot of CDEs can do this right now. But again, this is an expectation going forward for general practitioners in the future. So while we have to teach our students how to do this, we will have to teach them to master these concepts. This is something that is not ready for implementation right now, but will be expanding the scope of practice for dietitians going forward. Again, global community and public health is addressed in our enhanced competencies, and you can take a look at these, and I will be happy to answer questions at the end of my presentation. So let's talk about future education model changes that are coming to Iowa State. Iowa State applied to Ascend to be part of the future education model and create a graduate program, demonstration program at Iowa State. And we were given approval to move forward with this. So we are reorganizing our Master of Professional Practice in Dietetics program and integrating that with our dietetic internship and creating a future education model in a couple of years. We will be a fully online distance education program to train future dietitians. And we are hoping to have about 35 credits, and it will be completed in 4 consecutive semesters, fully online. We are trying to keep the same format of students who are in Iowa. They can do their rotations in Iowa, and then nationwide students can find preceptors where they are. What we are working on is how we integrate our supervised practice with our didactic courses and plan that whole curriculum for the students right now. One of the new changes with the future education model is that DPD verification statements are not required. However, since DPD programs are not going anywhere, we are choosing to enroll students who will be graduating from DPD programs. And our future education model is designed to build on the knowledge they are currently acquiring in the DPD program and give them skills that they will need at a graduate level to help them be successful in their future employment opportunities. Most facilities or most programs, the one at University of Iowa does not require students to have a DPD verification statement. Any undergraduate degree is acceptable, and then the knowledge requirements that they need are provided in the future graduate program. So students have the basic knowledge of food and nutrition, of anatomy and physiology, that are all hallmarks of a successful dietitian or an entry-level dietitian. This is a list of some of the courses we are planning on offering. These are currently part of the Master of Professional Practice in Dietetics program that we currently have. I see a few of our graduates from this program in the audience. So the only thing that will be changing is how we are integrating supervised experiential learning as part of these courses. We have curriculum courses on Advanced Nutrition 1 and 2. Advanced Nutrition 1 is essentially a course that focuses on macro and micronutrient metabolism. We are focusing on research methods and design in Advanced Nutrition 2. We have Advanced Medical Nutrition Therapy course. We have Nutrition, U.S. Healthcare and Policy. We have grant writing course that we offer our students, and we plan to continue to do that because based on the competencies and performance indicators for training and the skills required of the future dietitian, these are some of the courses we have identified that are critical to help us train future dietitians. So our timeline for transition is really the next couple of years. Our last DI class, or our plans are currently that the last DI class, independent, will start in January 2021. And in fall 2021, we hope to start our new future graduate program after receiving approval from Ascent. That's our timeline right now. So our last DI class will graduate in July of 2021, and in August of 2021, we hope to start our new future education model program. Hot off the press, I would like to issue you an invitation. We are trying to organize a workshop on competency-based education on Iowa State campus. So if you are interested in learning more about competency-based education, please stop by at the booth. We will have sign-up sheets available. If you are interested, we will send additional information to you on competency-based education and where the venue is and additional details if you are interested in coming. This will be an all-day workshop that you can hear more from the person who's leading the initiative with Ascend on developing competency-based education. She will be providing training on how to do competency-based education and competency-based assessments. If you are interested in learning more about the future education model and competency-based education, please again stop by our booth. We'll be happy to talk to you and provide additional information, or my email address is on here, and I will be more than happy to answer any questions or provide additional information for you. And I want to thank you for your attention, and I will be happy to answer any questions that you might have.
So dietetics. I'll talk about it.
That's okay, I'll repeat the question.
So dietetics is moving for competency-based education. Is this the future trend for like other professions? Teachers, physicians, physical therapists, or is it just dietetics that's moving toward that type of education?
So the question is this only dietetics, or are other disciplines moving to competency-based education? Other disciplines have already moved to competency-based education. I think we're a little late joining the party. I know medicine already uses competency-based education and training. I think pharmacists to some extent do as well as nursing. So this is not entirely isolated to dietetics training by administration of medication. Thank you for that.
Hi, I think this works now. So my question is I was thinking about offering a master's program to current dietitians. I understand we'll be grandfathered in, so we don't need a master's, but is there any plans to having something for those particular people?
Thank you for that question. So let me clarify something. The expectation that the CDR has that new graduates who will be sitting for the exam starting January 1, 2024 need a master's degree. That does not apply to current practitioners. You do not, I've heard this question from a lot of current dietitians who are practicing right now that they need to go get a master's degree. You really do not, unless you really, really want to. Okay, so let me clarify, let me reiterate that you really don't need to be, there is no grandfathering in. If you want to go get higher education, you are more than welcome to do that, but you do not need to put undue pressure on yourself to get it done before January 1, 2024. Okay? Iowa State already has a master's degree program. It is a residential program. You're welcome to apply to that. But as of right now, we do not have any plans, but we can definitely take that into advisement to offer another online program if that works for us. So thank you for that question.
Hi, I was wondering about the learning plans that we do every 5 years now for the academy, and I wondered the competencies and the performance indicators I saw there look sort of a similar format. Are those currently matching, or is the goal so that when you finish school and then you go on to do your CEUs, you're still looking at those same categories plus those new ones that are coming?
So the model is the same that we're using in the future education model and what is being seen in the new portfolio or goal wizard, for lack of a better word, of tracking our competencies. The good thing about the portfolio right now is you can track and change those to your required practice setting. You can change it 10 million times if you really want to. The performance indicators that we have in the training model are set and defined. So those will not be changing as of right now unless we get additional information from the feedback that programs are providing to Ascend. I don't know if I answered your question there.
Where would we find, I guess this is my related question, where would we find a copy of your slides that shows those comparisons of associate, bachelor's, master's, and then you could set those alongside the learning plan with ADA.
Okay, so the slides should be posted on the Iowa Academy's website. But if you want additional information about all three of the degree programs, the associate's, bachelor's, and master's degree levels, you can go to the Ascend website, and all of these future graduate program competencies and performance indicators are posted, every single one of them, along with a guidance document that provides some of those examples and illustrations on how to meet those performance indicators.
What was the website you said?
Ascend. So you go to eatright.org, which is the Academy's website, and then /ACEND. And that will take you to their website where you can look up future graduate or future education models. And then you have a whole host of documents available for you there.
Okay. Thank you.
You're welcome.
How do you see the new education model partnering with institutions like community colleges with the new associate degree requirements and potentially not needing a verification statement to go into the master's level? Do you see partnerships developing in that, either with Iowa State, or what bachelor's programs do you see pathways like that for students who maybe aren't looking for the traditional four-year education model on a state university campus?
I think there is a great potential for partnership with community colleges for students to complete their degree programs or take additional classes that can be transferred over. Or even if you do require additional supervised, let me try this again. So if you are interested in completing a degree program at a community college and are interested in the experiential learning portion, there is a possibility, and again, it's a possibility, and it depends on how the future future education model programs are set up at each institution, whether they can give you prior assessed learning. And then prior assessed learning is a way that some of the didactic portion that they've completed can be recognized and acknowledged into the new program that they're coming in. The difficulty I see, and I don't really have a good answer how this is going to be because we're trying to work on the same thing right now, is how the integration of the experiential learning, because that is an essential component Ascend is requiring, that you can't do what a lot of traditional DIs right now that are providing master's degree as well. You do the master's degree, then you do your supervised practice, or vice versa. Their expectation is that it is going to be synergistically combined together going forward. So that's the piece that I think is really missing right now. We need to figure out how to incorporate that if we expect students who are at community colleges to transfer into our programs. So don't have a good answer, but that's something we're working on. So thank you. Other questions on the enhanced competencies, on the future education model, on what our plans are? If not, thank you very much for your attention.